Hi, I'm Dr. Mark Bell, and welcome to Your Healing Minute. In this segment, we're going to be talking about proper sleeping posture. Many of you complain about feeling worse in the morning when you wake up than you did when you went to bed, and much of the time that's due to your sleeping posture. So I'm going to give you a few tips today, and we're going to talk about proper ways to sleep and proper ways you can help yourself. All right, so first, there are three main positions that people sleep in, which is going to be on your stomach, on your side, or on your back. So my assistant Kathy here is going to demonstrate these for us. So obviously this is not a mattress. This is one of our treatment tables, but you get the idea, it works the same. So in this position, people who sleep on their stomach, when you sleep on your stomach, eventually you will have neck problems. Okay, and the reason for that is because to breathe, you have to have your head turned all the way to one side or the other, because you're not going to breathe face down in the pillow. So you have to have your head turned one way or the other. And when you do that, that's put a constant strain on your neck muscles all night long, and you'll wake up the next morning with neck problems or a headache. So sleeping on your stomach, definitely the one position you don't want to sleep in. Okay, second position is going to be on your side. Go ahead. Be done this way. Okay. So as you can see, what happens here on your side is that in this position, you're either going to have, you're not going to sleep with your legs directly on top of one another. Your knees are going to hit, and that's going to cause pain as your knee bones are hitting together. So most people will sleep like this, one leg in front of the other. And what this does with this top leg, knee going down this way toward the mattress, that puts a lot of stress on your hip that's on the top and your low back. Not only that, as far as the shoulder goes, this arm has to go somewhere, the top arm. You're not going to sleep like this, so most people have it down like this, and what that does, that puts a lot of stress on the muscles of your upper back and neck. So the way you can help yourself with this is to get yourself a body pillow, or even two of them. I prefer to use two, I'm bigger, but if you're smaller, you can get away with just using one. And what you would do with this is you would put the body pillow between your knees here, and let's go all the way up. So you put your knee on it like this, and you put your arm over it like this, so you sleep just like you're hugging a person. Now what this does in this position is it puts your leg more at 90 degrees with your low back. So now what's happening is that this hip and leg are able to just rest on the pillow, and that takes all the pressure off your low back and off of your hip. So now it's being supported, and that holds everything at about 90 degrees, taking all the pressure off your hip and low back. Now with your upper back, with your arm over it like this takes all the pressure off of your shoulder and your neck. So, arm is supported, knee is supported, you'll wake up feeling better, taking the pressure off your low back and off of your neck. Third position is just flat on your back. The only things you need to worry about in this position really are the firmness of the mattress. You want to make sure if you're a back sleeper, you want your mattress a little bit firmer. Okay, not too hard, but a little firmer than you would if you're more of a side sleeper. All right, so you want a little bit firmer mattress, and your pillow makes the difference here, because you don't want a pillow that's either too high, that's bringing her head up like this, or one that's too low, where her head is more flat, okay? So you want a pillow that's gonna be just right. Basically, it's making sure that your ear is lined up with your shoulder, and that's how you can tell you're in good sleeping posture. All right, so I hope these tips help you to get a better night's sleep. Thank you very much for watching. Bye-bye.